don't stop. Don't stop. Don't stop. Don't stop. Don't stop. Don't stop.
Amoebiasis. What is amoebiasis? Amoebiasis is a parasitic disease, also known as amoebic dysentery or amoebic dysentery and/or amoebiasis, caused by infection with Entamoeba histolytica or another amoeba, for example, E. dispar. Most individuals with the disease may have no symptoms. E. histolytica is the species that produces symptoms only in about 10% of those infected. The single or one-celled, flash-shaped, or shifting-shaped organism usually produces dysentery and occasionally invasive extraintestinal problems, invasive amoebiasis, the most common of which are liver abscesses, although other organs can be involved. The disease is most common in people who live in tropical areas with poor sanitary conditions. It is estimated that amoebiasis causes 50,000 to 100,000 deaths worldwide each year. What causes amoebiasis? The cause of amoebiasis is infection by the protozoan parasite Entamoeba histolytica. It begins when a person drinks contaminated water or eats foods contaminated with the cystic form, infective stage, comes in contact with contaminated colonic irrigation devices or the fecally contaminated hands of food handlers, or by oral anal sexual practices. The cystic form changes into trophozoites, invasive form, in the ileum or colon and invade the mucosal barrier, leading to tissue destruction and diarrhea. These trophozoites can reach the portal blood circulation to the liver and eventually go to other organs. It only infects humans, and the CDC does not classify it as a free-living organism. What are risk factors for amoebiasis? Risk factors include drinking contaminated water, eating contaminated foods, association with food handlers whose hands are contaminated, anal sexual practices, contaminated medical devices such as colonic irrigation devices, malnourishment, recipients of corticosteroids, pregnancy, very young patients, and travelers to endemic areas such as Southeast Asia or Central America. What is the incubation period for amoebiasis? The incubation period for amoebiasis is variable. Symptoms begin to appear in about 1 to 4 weeks after ingestion of the cysts, however, the range may be from a few days to years. Is amoebiasis contagious? If so, what is the contagious period for amoebiasis? Yes, amoebiasis is contagious person to person. It is spread by the fecal-oral route by an infected person. The contagious period lasts as long as the infected patient excretes cysts in their stools. Consequently, the contagious period may last for weeks to many years if untreated. What are amoebiasis symptoms and signs? Although only about 10%-20% of people infected with the parasites become ill, those individuals may produce the following symptoms and signs. Early symptoms, in about 1 to 4 weeks, include loose stools and mild abdominal cramping. If the disease progresses, frequent, watery, and/or bloody stools with severe abdominal cramping, termed amoebic dysentery, may occur. If the trophozoites reach the intestinal walls and go through them, symptoms of liver infection such as liver tenderness and fever are the initial signs and symptoms of liver abscess formation, hepatic amoebiasis. Other organs, heart, lungs, brain meningoencephalitis, for example, may produce symptoms specific to the organ and produce severe illness and/or death. Abdominal tenderness and/or stomach pain. Tenesmus. Flatulence. Appetite loss. Weight loss. Fatigue. Anemia. Occasionally cause skin lesions, cutaneous amoebiasis. What tests do healthcare professionals use to diagnose amoebiasis? If your recent health history and travel history suggests a possibility of amoebiasis, your doctor may ask you to provide several stool samples to screen for the presence of E. histolytica cysts in your stools. In addition, some routine blood tests as well as other tests to determine if parasites spread to other organs may be initiated for laboratory diagnosis. These tests may include the following: liver function tests, serological tests, enzyme-linked immunosorbent assay, ELISA, ultrasound of the liver, CT scan of the liver and perhaps other organs, colonoscopy of the large intestine to search for parasites. Your doctor may run other serological tests to rule out other infectious diseases like giardiasis, paragonimiasis, and arboviral brain infections, for example. What are medical treatment options for amoebiasis? Asymptomatic infections are not treated unless they are occurring in non-endemic areas. If patients are shedding E. histolyticus cysts, the following luminal agents, drugs that work on cysts that are not invading the gastrointestinal epithelium, are as follows: paromomycin, Humectin, iodoquinol, Iodoxin, diloxanide furo to treat invasive amoebiasis, metronidazole, Flagyl, Metrogel, Noritate, is recommended even for amoebic liver abscesses, up to 10 cm sized abscesses. Tinidazole, Tindamax, is FDA approved for treatment of both intestinal or extraintestinal, invasive, amoebiasis. Other countries have similar drugs for treatments, but they are not available in the United States. Amoebic colitis can be treated with nitroimidazoles, but they should be followed up by a luminal agent. Treatment of hepatic amoebiasis has been successful in some patients with chloroquine, Aralen, or dihydroemetine, which is only available from the CDC and is not a preferred treatment because of potential heart toxicity. If the gastrointestinal tract is suspected to be perforated, perforation can occur with fulminant amoebic colitis. Broad-spectrum antibiotics may be used to prevent peritonitis. What are surgical treatment options for amoebiasis? Surgical treatments are required or indicated for amoebiasis treatment due to the following: gastrointestinal bleeding, massive or uncontrolled, perforated amoebic colitis, toxic megacolon, failure to respond to metronidazole after 4 days of treatment, amoebic liver abscesses greater than 10 cm in size, empyema after the liver abscess rupture, amoebic liver abscess representing risk of rupture to the pericardium, impending abscess rupture, no medical response in about 3 to 5 days to expanding abscess. Percutaneous drainage by catheter can be life-saving in patients with amoebic pericarditis. Are there home remedies for amoebiasis? There are many home remedies for amoebiasis available on the internet. They range from increased fluid intake, coconut water, buttermilk, black tea, and herbal tea to garlic, Indian lilac, oregano, and apple cider vinegar. If you think you have amoebiasis, you should discuss your symptoms with a doctor before trying any self-treatment remedies. What are complications of amoebiasis? Although infrequent, there can be serious complications of the disease. They include liver abscesses. It is possible to develop these abscesses without the typical diarrhea stage. Lung abscesses, brain abscesses, amoeboma, a large local lesion of the bowel caused by the response to the infecting parasite, fulminant or necrotizing colitis, rectal rational fistula, bloody dysentery, toxic megacolon, increased risk for cancer, and death. Is it possible to prevent amoebiasis? Yes, amoebiasis can be prevented by stopping the fecal contamination of food and water by the Centers for Disease Control personnel by correcting poor sanitation. Identification and treatment of food handlers or other carriers of the parasite can reduce the chance of getting foodborne amoebiasis. Avoiding sexual practices that involve fecal-oral contact also may reduce the chance of getting the disease. Avoiding malnutrition and alcohol use can reduce risk of the disease. Gallectin, an antigen from the parasite, has been used as a vaccine to protect animals against intestinal amoebiasis and against amoebic liver abscesses. Other parasitic components are being tried as possible vaccine components to use in humans. Unfortunately, amoebiasis doesn't result in any long-term immunity so that individuals can be reinfected multiple times. What is the prognosis of amoebiasis? What is the recovery time for amoebiasis? In general, the prognosis of amoebiasis is good since the vast majority of infected individuals showed little or no symptoms. However, if complications develop such as abscesses, peritonitis, or toxic megacolon, the prognosis may vary from fair to poor depending on the availability of medical support services. Recovery time for amoebiasis is related to the severity of the disease. If a person has no symptoms, there is no recovery time. Recovery time after medical treatment varies from about 1 to 2 weeks to as many as 4 weeks or more after surgery. You and your doctor need to discuss your estimated recovery time once treatment begins.